So what's the purpose of psychological assessment? To answer this question, we need to talk about a word you may not have heard before: biopsychosocial. It's used routinely in medicine these days, but what does it mean? To find out, let's go back to the way medicine was 100 years ago. Back then, to become physicians, people could study many different ways of treating disease: herbal remedies, homeopathic cures, various forms of body manipulation, and even nutrition. This created a lot of confusion as to what medicine really was and how it did and did not treat illness. So in the mid-1920s, the American Medical Association decided to standardize the medical approach to disease. They proclaimed that medicine was an explicitly biological field and designed a model curriculum heavy on biology and biochemistry. Medical schools that didn't follow the new model could no longer be certified and had to close. As time passed, biomedicine grew, and the other forms withered away. By the late 1950s, almost all physicians had trained in schools that focused on biology and biochemistry, and almost all research was focusing on biological causes and treatments of disease. So American medicine started an ambitious campaign: come up with a precise biological definition of every disease. They reasoned that diseases are due to biological factors, and so health must be biological as well. There must be a normal range for every biological structure and function. Any deviation outside of this normal range would indicate sickness. The project began well enough, but then problems began to arise. You see, the biomedical model looks for a specific deviation from the norm in order to diagnose disease. Yet sometimes a deviation is present, but neither the patient nor the culture thinks the patient is sick. And sometimes an apparent deviation really is within the normal range, but the patient or the culture defines it as an illness. Consider pain. Most pain stems from biological causes, as a burning pain may stem from pressure on the spinal cord, or an injection site may hurt. But some people, notably athletes and soldiers, tolerate even severe pain rather well, while others seem disabled by lesser pain. So when should we treat the pain, and when should we treat the person's attitude toward pain? And what about reading disorders like dyslexia? They appear to be biological. In fact, children with dyslexia show differences in brain structure on MRI scans, and these differences correlate with reading problems. Yet in Japan, almost no one has a reading disability. This is because the language is based on pictographs. Instead of matching letters to sounds within words, it uses a particular symbol for each word, and almost everyone can learn to read. So, is dyslexia a normal variant in the brain that happens to cause problems only in cultures with alphabets? Is the society causing the disease? Or is dyslexia a biologically deviant brain that happens to make no difference in Japan? In which case, why should we call it a disease? Alcoholism seems to be biological. Alcohol has very definite biological effects, and alcoholism even runs in families. But it's possible to reduce the next generation's risk of developing alcohol problems by up to 75% simply by having the family eat a regular meal together and preserve other rituals and traditions such as holidays. In other words, if we want to prevent transmission of alcoholism, it's important to know about one parent's biological status, but just as important to find out about the other parent's social and cultural choices. What looks like an illness can even be an emotion that the patient doesn't want to acknowledge. Anyone facing an anxiety-provoking situation is likely to feel racing heart, nausea, shortness of breath, and other normal physical changes tied to the natural fight-flight reaction. Yet some people are raised believing they have to ignore their emotions. As a result, when they experience even normal stress, they think these changes in pulse or digestion or breathing must be signs of a physical illness. They may visit a GI clinic, a heart specialist, or a pulmonary center, and move between different physicians and surgeons looking for someone who will cure the non-existent physical disease. Now here's the question. Is this person sick? Well, biologically, there's no deviation from the normal. Healthy people have all these symptoms when they face a grizzly bear or during a sales presentation, except that some people aren't comfortable acknowledging their own fear. So without the inner cueing that they're scared, they think they have a physical illness, and they don't. Yet we say that these people have somatoform disorder, and we all agree they need treatment, usually from a psychologist or psychiatrist. By the early 1970s, the ambitious program was in ruins. Diseases clearly have biological roots, and yet knowing patients' biology alone can't tell us whether they have a disease, a problem attitude, a stressful job, or whether they are just different from the average in a way that bothers them. In reaction, physicians such as George Engel came up with the biopsychosocial model of disease. The existing biomedical formula, they argued, is incomplete. By trying to be completely biological, it misses those factors that make humans unique, different from horses or dogs. Veterinary medicine can afford to be completely biological, but for those of us who deal with humans, we need to understand the person's attitudes, beliefs, and mental state, and sometimes the person's family, neighborhood, and culture, and how other people's attitudes can influence our patient's disease state, the disease process, and even the notion that the person is sick at all. Nothing less will do. Since Engel's original article was published in 1977, medicine has learned more and more about biology. There are many obvious benefits to this. But especially when treating behavioral disorders, treatment providers need to look at everything: the body, the mind, the emotions, and the culture, all the factors that influence the patient's decision to seek help. However, the enormous gain in knowledge of the bio side of illness makes it hard for medical staff to keep up with the equally enormous gains in knowledge of the psycho and the social. This is where psychological evaluation comes in. Psychologists keep up to date on the psycho and the social, the different kinds of mental, emotional, and social factors that can create, amplify, or sometimes impersonate human health problems. The psychologist helps to draw together the biological with the psychological and the social to help everyone understand the whole person. For example, gastric surgery can lead to dramatic improvements in body weight. Yet insurance companies now view it as standard care to have a psychological evaluation before surgery. This is to capitalize on the personal strengths and social support of the patient in making the surgery a success, as well as to deal with potential dangers, such as a non-supportive spouse or a past habit of emotional eating. These factors can be just as much a part of a successful outcome as the surgery itself. Or a child may come in failing in school, disruptive in the classroom, and defiant at home. Following the biomedical model, we might be tempted to jump to a biological diagnosis and begin treatment. But a psychologist will also evaluate all the personal and social factors that could be creating or adding to the problem. For example, how skillful are the parents? Nowadays, many parents simply don't know the best ways to respond to problem behavior. They unwittingly reward it, and as a result, the child gets more and more disruptive. Does the child have an undiagnosed learning disability? Learning disabilities can easily cause behavior problems by making the child feel embarrassed or humiliated. They can also lead to teasing and bullying. The result is that the child may begin to avoid school, disrupt the classroom, get into fights, and become sullen and defiant at home. Does this child's bedroom have a cell phone, iPad, TV, computer, Xbox, and sound system in it? Consider the possibility that this child is simply sleep deprived. And finally, what if the parent's marriage is full of conflict? Medicating the child is unlikely to help. If anything, it gives the parents one more thing to fight about, whether or not to medicate their child. In short, a psychologist looks at the big picture, including the biological, psychological, and social factors that can create a mood, anxiety, or behavior problem, and then helps create an integrated solution that targets the underlying problems, not just the symptoms. As part of this, the psychologist usually measures the size of the problem. How often are panic attacks occurring? How severe is this depression? How conflicted is the parent's marriage? Psychologists have hundreds of measures of different psychological and social factors. Their goal is not just to diagnose disease, but to measure and track causes and symptoms. Using psychological evaluation as part of the total clinical workup has several advantages. First, careful measurement helps to distinguish the true problem from the side effects. Thus, many elders complain of memory problems and are also depressed. Comparing different aspects of the two gives the treatment team the power to tell which is the main problem and which is the side effect. Treatment can then be targeted to the problem at the base of both complaints. Second, careful measurement helps everyone to track progress and verify that treatment is working. Just as a thermometer can verify that a fever is going down even before the patient feels better, so measures like the Beck Depression and Beck Anxiety scales can verify that mood and anxiety are improving before the patient notices. This can help everyone to stick with treatments that are actually making progress until the gains are fully realized. And third, assessment tools can help to tune the treatment. Just as a blood pressure cuff can verify that blood pressure has improved and yet is still too high, so a continuous performance attention test can verify that a child's attention problem has improved with medication but is still not within the normal range. This gives physicians the chance to tune the medication dose for optimal results. The end result of psychological assessment is a complete picture of the biological, psychological, and social sources of the complaints, treatment plans that address all the problems, faster improvement, fewer setbacks, less wasted time and money, and happier people all the way around.